You go into the office, they used an alcohol wipe to disinfect my skin, and then they put a numbing cream on your face.
Wow, that's a lot of numbing cream. Is microneedling a good treatment for you? Hey, I'm Dr. Jae Kim, a double board certified facial plastic surgeon, and I'm on a mission to make the world a more beautiful place, starting with you. Today I'm going to review a famous YouTuber's video about microneedling experience. We'll see what her experience was like, how the results were, and whether this is the right treatment for you. Let's go.
They basically use this pen tool. It gets a little bit peely or crackly. Definitely not as painful as an in-office treatment.
So peely crackly is about right in terms of what your skin may feel like the first few days after a microneedling treatment. But let's keep going and see what she has to say about microneedling and her experience.
Hey guys, it's Jen, and today I wanted to talk a little bit about microneedling. What is it? What are the benefits of it? My experience with it? Should you go like in office and get a treatment, or should you do an at-home treatment? There are so many different details.
There are a lot of different details when it comes to microneedling or any other aesthetic procedure treatments. It seems like, there are more varieties of aesthetic treatments than there are cars that you can buy. So the thing that you want to ask your aesthetic professional is, what does the treatment do, whether it's right for you, and what's the downtime going to be like, and what are the results?
I'm gonna talk about why I love it. I really love it. I've gotten it done a few times, so I wanted to give you the insight to know if this is a good treatment for you. First of all, what is microneedling? Well, it's kind of what it sounds like. There are a bunch of needles creating micro traumas, and then that sort of triggers your biological need to re-heal those traumas, and it basically boosts the collagen production and balance and glow and health of your skin.
So her explanation of microneedling is spot on. In terms of the micro injury that these needles create, getting under the skin to create a micro injury that results in your body's response in terms of building collagen to help heal your skin and to make it more vibrant, youthful, and rejuvenated.
In-office treatment, you would usually go to maybe like a plastic surgeon's office or a med spa. And then I would say the other camp is to do an at-home treatment. I'm gonna be sharing a little bit more about what I've been using at home. It's by a company called Cure. So I'll show you what that's like a little bit later on in the video.
So I'm curious to see what her in-office treatment was like versus what her at-home treatment experience is like. My bias as an aesthetic professional, as a plastic surgeon, is to have treatments like this in the office setting. But we'll see how the Cure microneedling treatment is and what her experience is like.
So in terms of my personal experience, I've actually had microneedling professionally done 3 times. Once was several years ago, and then I've also had it done twice within the last year.
So the one thing I will say is that just like other aesthetic treatments, you need to have microneedling done on a regular basis. So the most appropriate time frame to have, let's say, about 3 treatments usually recommended is about 1 month apart. So let's say if you do one today, you would do one about 4 to 6 weeks after, and another one about 4 to 6 weeks after. Another thing to remember is that you need to abstain from certain skincare products before treatment and wait a few days after treatment to resume. But she might have more details on that, so let's continue.
I actually did microneedling with PRP, which is where they basically draw blood from your own body. They separate the plasma. When they do the treatment of the microneedling afterwards, they actually put the plasma on your skin, and then the healing parts of your own blood's plasma helps to heal your skin.
So I love PRP. As Jen explained, PRP is platelet-rich plasma, which you get from your own blood. So it's completely natural because it's your own body product. And PRP contains things like growth factors and hormones that are regenerative in nature. So PRP has many uses, both in the aesthetics world and also in the medical world. So for example, there are a lot of athletes who get PRP injections for their joints. The late Kobe Bryant, rest his soul, had knee injections with PRP during a couple of off seasons I can't remember which year exactly, but it did help to accelerate his healing and help him get back on the court with the maximum level of his performance. So when it comes to PRP for aesthetic treatments, and particularly in use with microneedling, it's a very good additive. And how it works is that when your aesthetic professional applies the PRP topically onto the skin along with the microneedling, the skin that has been microneedled, it really absorbs it kind of like a sponge. And so it's a direct way of the good products from the PRP, like the growth factors and hormones, to seep in through the skin through these microchannels that are open for about 24 hours.
That was actually a very positive experience for me. I felt like I really had such a glow. That glow to my skin, I would say, lasted for about a month or two. When I got it done this year, instead of using my own blood plasma, what they used afterwards was called exosomes. So actually, exosomes, plasma.
So I know she'll explain a little bit about exosomes, but we recently got exosomes at the office to use with our aesthetic treatments, kind of like cherry on top of your sundae. So she'll explain exosomes a little bit, and I might have something to add later on.
I would say that's almost like an add-on, but if you can get those in, I do feel like that adds to the boost that you get with those micropunctures. All of that good stuff gets to sink in like much, much better.
I absolutely agree with her take on exosomes. Now, exosomes are basically tiny molecules that are made in our own body. And what they do is they signal adjacent cells and tissues to undergo regenerative processes. So when it comes to having exosomes directly administered on top of the skin for microneedling, and those exosomes seeping down in through the microtunnels, the microchannels, there's a lot of great regenerative potential for healing of the skin.
So basically, you go into the office, they used an alcohol wipe to disinfect my skin, and then they put a numbing cream on your face. It's okay to request them to be extra diligent about going all the way up to your hairline.
Wow, that's a lot of numbing cream. But to be fair, when you use a healthy layer of numbing cream, you get a really good anesthetic effect. And she's totally right about trying to get a little bit more near the hairline because that's where it'll be a little more sensitive. When I've had microneedling treatment done myself, the probably the most uncomfortable area was right around the hairline here. And part of it is because the forehead is more sensitive, but also there was probably a little less numbing cream applied right at the hairline. I mean, I don't care if my hair is a little messy with numbing cream afterwards if I have a little more comfort during the treatment.
Then the actual treatment, it goes by pretty quickly. I would say like 10-15 minutes max. They basically use this pen tool, which is mechanical, and then the needles are at the end of it.
Is that Dr. Chu himself doing a microneedling treatment? Wow. I mean, she got the VIP treatment. Um, some plastic surgeons do the microneedling themselves, like the non surgical aesthetic procedures. But wow, somebody of Dr. Chu's esteem and renown and popularity, I mean, Jen got it good.
It kind of depends on how much numbing you get, but I would say the parts that I felt like were a little more painful were anywhere you were a little more bony. So like on the tops of the cheekbones, around the eyes, around the hairline, definitely the jawline.
Yeah, I would agree with her on that. In terms of the pain level, usually it's like a 2 or 3 out of 10 for me, but the places that are the most uncomfortable are exactly where she said. So along the forehead, around the eye socket bone, along the cheekbone and the jawbone. And that's just because, nerves come from the bones. And so nerves exit through the bone onto the tissues. And so when there's less distance between the bone and the area being injured, so to speak, then it can hurt a little bit more.
On the nose felt super weird. That made my eyes water a little bit. And then afterwards, I felt like I was quite red.
So when you have an insult near your nose, including microneedling device, you're prone to tearing because it's your face, it's your eyes protecting itself as a mechanism. And actually, the tip of your nose is actually wired in terms of sensory nerves to link up with the upper third of the face. We call that nerve V1, or the first branch of the trigeminal nerves. And that's the nerve that gives you sensation to your entire face.
They put this serum or plasma or whatever it is on your face. You want to keep that on your skin as long as possible so everything soaks in and you really get the benefits of that. You don't want to just like go home and wash it off.
Yeah, so when you apply PRP at the end of your microneedling procedure, I tell my patients we keep it on for 4 hours. And then what we do as a bonus is we send you home with a little bit more of your PRP. And at the 4 hour mark, you can apply another layer so that you get an extra effect of your PRP being soaked up by your skin.
As that stuff dries on your skin, it gets a little bit peely or crackly, which is also your skin healing as well, but it's also because like I didn't put on additional moisturizer on my skin until the next day. Healing for me took, I want to say, about 4 days till I felt like my skin was looking pretty normal again.
So those shots of her skin healing over time, over the first few days, that looks great. So she got a really good treatment and her skin is reacting appropriately. And I'm sure the PRP add-on did a great job as well.
I was very, very diligent about hiding from the sun. Honestly, that whole first month after I get it done, it's good to look for a really good mineral sunscreen and use it really regularly. I was also wearing sun hats every single day and pretty much trying to avoid going out.
That's so true about, protecting yourself from UV, from the sun, especially when your skin is so vulnerable. Microneedling treatment is an injury to the skin. There's no two ways about it. So you want to do your best immediately after treatment to make sure that you're using a good sunscreen, applying a physical blocker. That can be a visor or a hat. In terms of sunscreen, she used mineral sunscreen, which means the main ingredient is either zinc or titanium or both. And a great sunscreen that we have here at the office that includes one or both ingredients is Elta MD. And so we strongly advise our patients after aesthetic treatments, including microneedling, to apply sunscreen regularly. If you happen to be out in the sun for more than 90 minutes at a time, you have to reapply every hour and a half or so.
After a week, that is when my skin really started to glow. That's when I really started to look like a little extra special in my skin. By week 4, when my skin had started to actually get that benefit from the collagen boost rebuilding itself, that is when my skin looked the most youthful and plump and glowy and juicy.
So plump, glowy, juicy are all great terms when it comes to having skin that is healthy and also looks healthy. So yeah, that little video clip of her with her skin a month after is awesome.
In contrast, I would say that the micro needling type of treatments I've seen at home, sometimes it can be a little riskier in terms of keeping things super sanitary. Rollers tend to be a little less safe just because the way that they slice, it does more like a cutting motion versus a stabbing motion. Do you get what I mean? Like if it goes straight down, there's less trauma to the skin than if it's rolling, making long cuts through the skin.
So Jen makes 2 really good points right here. The first is the cleanliness of an at-home device, which you're reusing. You're using the same needles over and over again. Compare that to an in-office treatment where each cartridge for the microneedling pen is used once and only once for you that day. It's not safe for another day. It's not safe for your sister or your mother. It's not safe for another patient. That cartridge is only for you. So that's a one-time use for cleanliness and for sharpness, because hell hath no fury like a blunt microneedling pen. The second good point that Jen made is about rolling microneedlers, so derma rollers. And I'll just say this, when she says the word slice, that's exactly what I think it's doing. So if you can imagine your skin right here and that wheel coming like this and shearing, slicing the top layers of your epidermis, that's not a controlled injury. That's a reckless, haphazard injury. So I strongly recommend against rolling microneedling devices.
I have used an at-home device that I am really happy with the results of. And I think the big key things is if you do something at home, try to get a device where the needles go in really straight and you're able to keep things really sanitary.
Straight and sanitary. That's the rule. That those are the two things again that are super important when it comes to microneedling, because you want a controlled injury that's perpendicular to your skin, and you want that to be super clean. I'm curious to see what this at-home device does in terms of its cleanliness and safety.
So let me show you what I've been using. It's actually called Cure.
So I'm curious about this Cure product. If it's something that I think is of merit, it might have a role for my aesthetic professionals in the office. So let's see what it's all about.
So let's go ahead and let me show you how I applied this to my skin. So the Cure system actually comes with two different serums. I'm gonna be using the rejuvenating serum, which has epidermal growth factors, because a lot of my concerns are extra pigmentation and I just want a lot of plumpness as well. But they also do have a hydra soothing serum, which has beta glucan. And these are just like one-time use containers.
So both serums have really good utility in terms of skin rejuvenation. So let's see how she applies it, sets it up, and does the treatment on herself.
And then I'm just pouring it into the treatment container. This top part right here is already kind of structured so you can't make it go too deeply into your skin. But the actual needles are smaller than the width of your hair. Plus, it's completely sterile because this piece is disposable. You just use it once and you throw it away.
So that's great that this at-home kit uses disposable needle sets. And that's the best way to keep things sanitary. Even if this Cure device is going to be used only for you, you don't want those needles sitting around collecting dust, collecting germs. And then if you use that same set of needles again at another time, then you're introducing those things that are on the needle point. So very good for Cure to have disposable cartridges.
We're going to go in a pattern from the center of the face and go outward with a 50% overlap. If you have certain areas that have more textural problems, scarring that you would like to really fill in, you can go over that area 2 to 3 times. I'm actually going to try to keep this tilted downwards so that the liquid continues to go down the needles. So this is more like a little stamping system. It's definitely not as painful as getting an in-office treatment. And I feel like the parts that I started are already starting to be less red.
So she's talking a little bit about technique here in terms of microneedling, and that's what aesthetic professionals do as well. If there's a particular area of concern, it might need a few passes. We call them passes in terms of treatment. And some of the areas where we might do more passes include areas of deeper acne scarring or more concentrated acne scarring, areas of increased pigmentation or fine lines. So definitely tell that to your aesthetic professional before you start the treatment that day.
But this is also going pretty quickly. It's a little prickly, but definitely not too bad.
So you can see she's really doing the microneedling treatment. Her skin is turning a little bit pink, which shows that she is stamping the skin with the Cure device in earnest. So it's good to see live and in living color what actually is happening with the microneedling with this Cure device.
Okay, so now I'm done with the actual treatment part. The rest of the serum that's left over, because it doesn't all come down through the needles, I'm just going to use it and spread it on my skin. Again, make sure your fingers are still very clean, but we don't want any of that nice, beautiful serum to go to waste. So I'm going to let that marinate on my skin for the rest of the evening, and then I'll show you what my skin looks like tomorrow.
I love when people say the word marinate. It just shows that they're really enjoying the experience, and the intent is for it to kind of rest and let it do its thing. And that's a very good tip. If you have extra serum that's dedicated for you at the office, whether it's exosomes, whether it's PRP, ask to take it home. What's the harm in that? Just make sure that, again, you clean your hands thoroughly before you apply it to your skin.
So it's the following day. I feel like my skin is looking quite glowing, clear, nice.
So I feel like Jen gave a really candid take on her experience using the Cure treatment at home. I think Cure is a good option if you're not quite ready for a visit to your aesthetic professional for your microneedling treatment.
The biggest thing it does is boost collagen production, which really can help in reducing the appearance of fine lines, wrinkles. It's supposed to help like reduce pigmentation if you suffer with acne scarring. It's especially good if you have textural issues, like if you have pitted acne scars. This can actually truly improve that over the course of getting multiple treatments.
So Jen lays out exactly what microneedling helps with. These are common concerns for people who have textural issues, damaged skin, acne scars, things like that. So microneedling is definitely a great option, just like she said.
Considering it's also scar tissue, this can help improve the appearance of things like stretch marks as well. And then I'm gonna make a separate category of things that it might help. Brightness of tone, pigmentation. I have seen some evidence of people using it to improve their hair growth when they have hair loss on their heads as well.
Microneedling can have some efficacy with regard to those following things, including pigmentation and including hair loss. So micro injury to the skin around the hair follicles can help stimulate hair growth. That's another topic for another day, but certainly that is in the wheelhouse in terms of non-surgical hair rejuvenation.
What is it not helpful for? It is really not helpful if you have a lot of current acne breakouts. You don't really want to be puncturing the acne wounds and then spreading around any kind of bacteria like that. If you are somebody with active breakouts, you can just do the microneedling and avoid the spots that are actively broken out.
That's absolutely spot on. If you do microneedling on an active area of acne, there is a chance that the germs from that acne can be spread to other parts of microneedling treatment. So you don't want to carry the oil and germs from an acne spot onto the rest of your face. Then you would break out for sure.
I would also say it's not really something that can improve the appearance of permanent pigmentation spots like moles or freckles. If you want to get rid of things like that, you probably want to do something more like a laser treatment that targets pigmentation.
So there's a variety of treatments that aesthetic professionals have at the office or med spa. Talk to your aesthetic professional about which treatment is right for your concern.
In terms of pricing, it definitely depends on the area that you live in. If you're in a big city or a smaller city, how available it is. I did a quick Google search and I think that you could expect for a single treatment maybe as low as $200. I haven't seen that in my area, but it's possible.
Cheap treatments are not always the best. I've seen little flyers and hair salons, won't name names, but they have someone who does microneedling for $100 or $150. Yeah, don't go for that.
Up to, I would say, about $1,200 per treatment. There's a very wide range of prices it could be, but I do know that most offices, if you buy a package deal of getting multiple treatments done, then altogether there's usually some sort of discount.
So not only is it better for your wallet in terms of buying a package, it's overall better for the outcome. One microneedling treatment by itself is not really going to do much for you in the long run. So you definitely want to have a package of maybe 3, and you want to do that maybe once a year.
Actually, with a lot of in-office treatments, not just microneedling, some other lasers and other treatments as well, you get the most benefit out of it when you have multiple treatments. So if you were to get like 3 treatments done a month or 2 apart, that would actually be where you would see the most dramatic difference from beginning to end versus if you just did a one-off. Oh, and I also wanted to note, as a retinol user myself, I use tretinoin every single day. If you're doing something like microneedling, I would stop using tretinoin for about 5 days before the treatment begins.
That's a very key thing that our staff always tell patients leading up to their microneedling treatment or aesthetic treatment for that matter, to stop your active ingredients, especially retinol, about 5 to 7 days before. You also want to wait a few days after treatment before you restart.
So I guess that is about it for the video.
All right, that was a great video from Jen about her microneedling experience. Couple of things I'll add to her content. The first thing is that there's regular microneedling and then there's radiofrequency microneedling. So the difference between the two is that radiofrequency adds an element of heat energy. What that means is that while the needles are under the skin, the radiofrequency energy is emitted so that heat is a form of thermal trauma in addition to the needles that are mechanical trauma. So the combination of heat trauma and mechanical trauma under the skin helps to rejuvenate by stimulating collagen production. The other thing that I will add is that another limiting factor in at-home treatments is that you cannot adjust the depth of your needle when it comes to microneedling. So when you have a microneedling procedure and you want to treat this area of thick tissue like the cheek right here, your needles have to be longer so that you reach the depth that you need to reach. Compare that with the skin of your forehead, where the needles have to be really superficial. So that adjustment factor in the needle depth is really important when it comes to making sure you have the most effective microneedling treatment possible. All right, that concludes this episode of Plastic Surgeon Reacts, and we'll hopefully be back with another episode in the very near future. Let me know if there's any particular content that you want me to review and react to. Otherwise, we'll see you next time. Until then, stay beautiful.